All right, Zoe, can you get us live streaming?
It's happening.
Okay, let us know when you're ready. And am I recording or are you? Oh, yeah, that question.
We put yours.
Are y'all set, Zoe? Yes, we are live. You are
Okay.
awesome.
I'm gonna go ahead and call us to order. Thank you for coming on this very beautiful day of April. So hopefully it's the sign Ithaca College turns its fountains on, so that is the official sign that spring has begun, okay? Okay, we have no one for privilege of the floor, so I'm gonna go ahead and move the approval of the minutes. So could I get a motion to approve as written, a first from Sue, a second from Ravinder? Any discussion? Comments, edits? Okay, all in favor as written? And we're unanimous. I'll go, is Jeremy?
Jeremy is not,
Okay.
he's out. But by way of update on the financial report, we're still waiting for the finance department to finalize 2023 for us, so we don't have a final summary on that yet. Hopefully next month. And I don't think we have anything really significant to report for the first quarter of the year. Any questions that we have to try to answer?
Any questions from board members on the financial summary? All right, I'll go ahead and move on to Dr. Claypack, who we missed last meeting. Welcome back. Give you the floor for your report.
Don't have anything to add to what you have in front of you.
Any questions from board members? On the report. All right, next up will be Frank.
Just two quick things to mention. One, point of interest, the county is going through a process of updating the webpage, the county's webpage, which includes us. So we are part of a larger project, expecting that to be launched, I believe, by the end of the calendar year. So some of it will make some changes to the way the Board of Health page is displayed. But we will continue to make sure all of the minutes and agendas are available to the public for their review. So just know that work's going on. And I did want to mention too that county finance is working on, I guess, bringing us up to current day requirements with purchasing, which has really expanded the need for us to do RFPs. So we've got several that are out there now, and there'll likely be more as we go through our next round of contracting. So just wanted you to be aware that if you're seeing announcements about a lot of RFPs, it's not a lot of new stuff. It's really just a shift in approach with county finance. So there is some new stuff that's going on, and we'll talk a little bit about that in my presentation at the end of the agenda. But there's a lot of stuff we've been doing for a while that the process is changing and we maybe RFPing for. So just wanted you guys to be aware of that.
Thanks. Any questions for Frank? I had one question, Frank, just on your report. The substance use subcommittee, is that a subcommittee of the legislature?
No, it's a subcommittee of the Community Services Board.
Oh, of the community, okay.
Yeah, so the Community Services Board has three subcommittees, one for mental health, one for substance use disorders, one for developmental disability.
Got it. Thank you. Any other questions? For this report? Okay, Rachel.
I just have one addition to my report, and that's that I'm sadly losing another nurse. So I'm still hiring for a nurse and a senior community health nurse. So now it's two nurses and a senior community health nurse. So the hiring process continues in my division. Just to let you know so you can spread the word.
Rachel, can I ask, I just have a quick question about that in terms of how we can employ people, is there any such thing as like on-the-job training for nursing that we could hire somebody who isn't already a nurse and provide them with training to get them to the right credential? Or does that not happen?
Right, it is required to have a registered nurse license. I mean, we will provide them with training in public health
Right.
and public communicable disease and everything else they need, but yes.
They have to be an RN
Yeah.
coming in, okay?
Yeah, all the nurses in my division work in our immunization clinics, so they have to be able to vaccinate. And that's a restricted role. And we've just decided to keep it nurse specific.
So there's no different kind of credential that would permit somebody to vaccinate aside from a nurse?
Well,
Like somebody that was, I'm thinking of like Steph
an
Webb.
LPN.
Exactly.
there's different kinds of nurses, sure. I mean, the pharmacists vaccinate,
Right.
we just haven't included those roles here, yeah. I mean, we also, we hire fellows, we hire support staff, we hire community health workers. So all different roles available.
Yeah.
Okay.
Do we know why, or we've been through?
We're in definitely a transition with staff in my unit. This particular nurse decided she wanted emergency room experience, so she's going to the ER. There's a lot of opportunities for nurses right now, so you can pick what you want. And public health is a very specific field, you know, it's more prevention work, it's more desk work than maybe some nurses want, but that's just the nature of the work, so.
We interrupted your train of thought.
That's okay. I have to add to my report was just hiring.
Okay. Any other questions on the report? Great. Sam? Sam online?
Sam is not gonna be with us.
Okay.
so.
Right, so I guess I will move on then. And then let's do Jessica next. Sorry, my thing is now backwards, so. No, that's okay. It must have come out of the copier. Go ahead, Jessica.
All right, that's okay. I have two things to add. One, we are in the process of interviewing a speech language therapist for our in-house position. Stay tuned. And then second, the early intervention hub, the new billing platform that the state is launching, they pushed the launch date out to October 15th instead of June. So we will feel better prepared about that.
Just by way of update, I think you guys remember the legislature authorized 4.5 positions, 2024. We've got the one applicant that we're looking to hire. So staff is looking at an alternate proposal that would allow us to hire speech therapists, but use the other funding for a stipend. That we'll be looking to propose that to county admin in the next week or so, and then to Sean and Deanne, who supported this to begin with. And then off to the legislature to see if they would support us using the ballot. We have not been successful in identifying the folks to fill that. Just did a survey of the existing providers, and their number one, I think it was their number one issue was the rate not being sufficient. So we're kind of going back to the drawing board and looking at alternative options. On the good news front, there in the state budget, there is a 4% rate increase. 4% is very little, but it is something. There is also an additional 5% rate increase that's proposed for rural underserved areas. They have not yet decided who are rural underserved areas. They're working on that. So as soon as we know, we'll let you guys know. But even in all of that, even if we got the extra 5, you're talking about a 9% increase when we've been advocating for an 11% increase for a while. And knowing that really wasn't sufficient. So it is good news and we're excited for that, but it really would be helpful if the state could, do some significant movement on those rates for us. So in the interim, we're gonna make a proposal to the legislature to try to do something.
Do you still have these positions posted though, pending that?
Yes. I believe they're still posted right now.
The county recruiter also been trying to search for these positions.
It's a good question, Sean. I don't know the answer to that.
Okay.
It'd be great if maybe you could put in some time and I hate to recruit from other communities, but.
Other communities are great. We don't want to pull from ours.
That's right, that's right.
I'm sorry.
So there's, what is this person? This is
We have
the,
a county recruiter in human resources,
who is, what's the person's name?
Larry Workman.
WORKMAN.
Yes.
Sam, it's like you appeared, so I summoned you, yes. So the one other question I had was, I was just curious about the pinwheels that are in the buckets. And what those are. So who's, I don't know who those belong to, okay. I was gonna ask Sam, because I thought they were Sam, but okay, yeah.
Are they beautiful?
They are, well, I wanted to take one, but then I thought I should probably ask first.
You can take one.
Okay.
Yeah, they have little signs that say, please take me.
Yeah.
We received them from Cornell Cooperative Extension and they're for April's is Child Abuse Awareness. They gave us a stack of them and we've displayed them up front and we have them in a vase upstairs as well.
Previous years, they were stuck in the ground
That's what,
out in the middle, but I don't think anyone felt like they could take them when they were stuck in the ground. So this is a different
The
approach.
children had fun planting them in the pots.
Yeah.
I did take one. Okay, I didn't want to take it and then I've done something else.
There's a camera out there.
Oh, yeah. Right.
Garden.
Okay, all right, now I've lost track of what I'm doing. Am I Jessica? So now I'm on Adriel. Oh, Sam, did you have anything you wanted to add to your report?
Just that I put out these two small posters. We have larger ones as well, but this is a community visioning exercise that we're doing as part of the MAP process or our community health assessment process. And this is one of the first activities to collect some input from the community on these two questions. Our community includes, so who is in our community, and our vision for a healthy community is if in 5 years our community achieved health equity, what would be different or what would it look like? So if any board members want to use a sticky note or two and put up some comments before you leave today, that would be great. We did an event at the library a couple of weeks ago, and then we're making larger posters of these that are going to be placed around the community for a couple of weeks. So like in some of the rural libraries, and one is at the YMCA right now. And we're going to have a virtual event, which there are flyers about next week. So there will be more opportunities for community engagement, but this activity is around collecting information so that we can summarize it and come to like one vision statement for the process to help guide the process. And then we'll be doing more from there. So.
Thank you. Any questions for Sam? Okay, Adriel.
I'm Liz's stand-in today, and Liz is off at the conference for environmental health directors for a couple of days. So I get to come here in her place. I don't have any updates to add to what's already in the agenda.
Any questions on environmental health?
One question in regards to, I saw the letter that was provided in our package from Ms. Virginia Benton in regards to her permits and the issues, how it was unclear to her. And wanted to see if you can explain that to us a little bit.
Why the difference in, well, so our fee schedule, which is included there, does show that for new construction, we have a reduced fee for onsite wastewater treatment system applications for permits that are submitted by an engineer, outside engineer. But that's for the reduced application price, and then we do have a plan review fee of $90 for a system that's 0 to 499 gallons per day. We don't, with new construction, it's a very uncommon thing that we receive plans from an outside engineer. Usually that's when you have an architect that's designing the system along with the plans for the home, and so they will send that in. It's really uncommon for us to receive it for replacement systems, because the replacement systems are done a little bit differently. We do our best to code, but we have to work with the situation that's involved. So we aren't typically referring those out to an engineer. If they're problematic, we'll do them in-house. New construction, we will refer to an engineer. So it's pretty uncommon, very uncommon for us to receive those from an outside engineer. And in this case, for whatever reason, that person did use an outside engineer, and we don't have that reduced fee for that.
I think and I talked to Liz about this too, because I think it's a bit counterintuitive, right? Where a permit comes in and we have to do the work, and we charge less than if an outside engineer does the work, right? And so that seems counterintuitive. We're doing the work, so why wouldn't it? The reason for that, as I understand it, as Adriel was just laying out, these are very complex, particularly on replacements, right? Because it's something that failed and there's a lot more to it. And when outside engineers do it, ironically, it ends up being more work for us because we have to do a lot of review work. There's a lot of back and forth with the engineers to make sure they understand the rules and everything is in compliance. So I think that's some of where the confusion came in for the applicant, was that she paid for her own engineer to do the work and her permit fee went up versus if we had just done it. So Liz is gonna look at it with the team and try to figure this out moving forward, because like I said, it feels counterintuitive, but it is the reality of what we experience with those types of permits. I do believe the applicant has been explained all of this and is now in a okay place. But we are going to look at it further and see what makes sense moving forward.
No, one concern seems to be that this homeowner didn't know that the environmental health even would design systems for her. So is that communication to people part of what?
Well, sometimes it's also, and correct me if I'm wrong, Adriel, but the contractor, the person they're working with, does some of that communication for us, right? So they call someone up and say, hey, I need to get a new septic system. What do I need to do? If the contractor wants to use an external engineer or recommends that or doesn't tell them, then that communication happens external to us. Is that a fair?
That's accurate. And certainly if we had received that call first, we would have let this person know that we would do design in-house likely.
How did this person find out she needed a new septic system? Is that a communication that, someone inspected it and told her?
In this particular situation, I don't know the answer to that. It can happen in a few different ways, if there's a failed system and you actually have sewage on the ground, the homeowner may call us up and just let us know, or they may not be certain what that is, ask for some records to identify where their sewage system is, and then realize it is, and then call us back and start the application process. Sometimes it's, when somebody's having their tank pumped out, the tank, the septic hauler will come and say, your tank is not draining properly. You probably have an issue there. And, refer them to the health department, or, some of these septic haulers are also contractors that will, construct systems. So they may tell them that that's, the system is failed, and by the way, I construct systems, so why don't you work with me?
Is it within our power to waive the $190? I mean, I feel like even for the Board of Health, it's very confusing, and it shouldn't be that confusing for the people that live in the county.
certainly the fees are all within your power to do whatever you choose. I would, the only thing that I would suggest is that in this instance, it was communication with their hired contracting folks that led to the misunderstanding. Where we got involved is when she called to get some clarity and then trying to help her understand, what that meant, I think is where the counterintuitiveness comes into it because of the way it's set up. So, but as far as that, you guys have whatever authority you'd like to exert on the schedules or anything we charge.
I would like to make a motion to waive the $190 fee that she was charged.
Just the clarification, I believe it will be a refund of the $190.
Can you say it again then?
Yeah, I would like to make a motion to provide a refund of the $190 that Virginia Fenton of 182 Asbury Road is charged for the plan review.
Is there a second? Second from Ravinder, discussion? Yep.
Is there a way to find the contractor for not referring them to us?
No, they don't have to. The contractor didn't do anything wrong. You can use an outside engineer and they can recommend that if they think that's what's appropriate. Like I said, I don't, they didn't do anything wrong, in this situation. I think, there was a less expensive way to do it if they had chose to go that route, but the contractor, for some reason, may think it's better to get an outside engineer, and that's their decision and choice when they recommend something to a customer. So I don't want to make it sound like the contractor did anything wrong if they did not.
Is this is this information available on the website for the health department? How do people get this information? How does the homeowner kind of find this sort of?
It's been a while since I've looked to see if our fee schedule's on there, but I believe I'm not sure if our fee schedule is actually online, but the price of the house application is listed online, and if they call and want to talk with it, our inspectors, staff people upstairs will explain the process to them.
Is there a way to make the fees equal and just feel like they're gonna balance out? This way it's not, because it is super, I would have no idea.
Yeah, no, I agree. And I think that's part of what Liz and the team are gonna look at is what makes sense to provide some clarity. I don't know that this has ever happened before, to be honest with you. Because most people do call us as their first call when they do these things, and so we're able to educate about this. This was just a weird confluence of, different things that occurred in this particular situation. We're gonna look at it, absolutely. What we're also trying to be mindful of is the demand on staff time
Yeah.
from these outside entities. So that's really what, we look at what takes us the most work to do when the fee schedule is kind of developed from that perspective, so.
I guess just to stimulate conversation too on this is that this was not a miscommunication by the health department. This was a contractor that somebody hired that didn't communicate properly with the homeowner. So I think when I think about things that we have waived in the past and what times that we have made decisions to waive things, I think we have taken into consideration, was it something that we did that put somebody in a position that was unfair or something. This feels a little different to me because this is somebody that was hired specifically to provide a service. If anybody should pay the $190, it should be the contractor, because that's the person that misled the homeowner, not the health department. And our health department staff already invested the time that's needed to do the review, which is why we have the fee schedule set up the way it is, right now. So then I would ask, if we're going to do it for this, why this person? What if tomorrow another thing happens? I know Frank is saying this is a one-off, but then we have another situation where we have a contractor who's hired to do something who doesn't know the rules or isn't communicating correctly. Do we just keep waiving stuff moving forward? If we waive it, we're setting precedent. So I just want to be careful before we do that and have a discussion.
And if I can just provide a little bit of context to that, I don't wanna negatively portray the contractor in this situation. They have the right to quote the job if they have it done in whatever manner they think is most appropriate. At worst, they didn't provide all of the options available, but I don't know that there was active misleading that occurred so much. I'm completely supportive of what you're saying, Christina. I don't want to paint a super negative picture of the contractor because they didn't technically do anything wrong. And anyone can sell a product in a way that they think is the most effective way to get it done. And if they think an outside engineer is more effective than using us, that's fully within their authority to do and to make a recommendation. You could argue, should they have put all the options in front of the homeowner? That's, that you certainly could argue, but I don't want to paint a super negative picture of it.
Yeah, not to put too much time into this, but I think, I'm not sure there's like an at-fault person or organization here. My guess is Gaggle is a reputable provider here in our county. They do these constantly all day long. And, the fact that we sit here and we have the fee schedule in front of us, and even amongst the board members have questioned, like, why this happened, what should the person have been charged? We don't know for sure if it's up on the website, if it's clear. I think there's an education piece missing that we probably should communicate with these septic providers about this additional charge. And, we could say all day long, it'll open the floodgates and everyone's gonna come through and it's been set precedent, but in the 8 years that I've been on this board, this is the first time I've ever seen this. So. Can't imagine that.
I mean, I guess I also think we don't have enough information. For all we know, the contractor did provide the information to the person. And that person didn't interpret the information. I mean, we don't know. So, I mean, this is not a new feat. This is not new, right? This splicing has been here for years and years and years and years and years. So and I think somebody who's owned a septic system or people that are working on septic systems, I mean, it's your responsibility to sort of understand. Yeah.
I think maybe we just don't have enough information here to make this decision at this point. And perhaps we can have it brought back to environmental health, figure out what happened. Sounds like there was more discussion that was going to happen on this particular case.
And I don't know that there.
Oh,
will be more,
I
but
I think it's actually, they said it's already been, she already paid it.
I
But
just-
it was satisfied.
I
with
wasn't
them.
personally involved, so I'm
Oh,
not.
not been, well, maybe I'm sorry, but like looking at the fees and making sure that it makes sense.
Yes, we're gonna do more.
So
Yeah, for
perhaps once that
for
starts
next
around.
year's
okay.
fee schedule, I mean, right, I mean, it's hard, I guess it's hard to, create a fee schedule that includes every single scenario, but yeah, to receive a replacement application that's submitted by an engineer. I mean, of all the years that I've been involved in that program, I don't recall that happening. Like I said, it sometimes happens with new systems, and that's why we have the reduced fee there, but it hasn't happened with replacements, but now we see that it can, so we'll discuss it.
I just wanted to clarify that the fee schedule is on the website though.
Yes. Their discussion. We ready to vote? Okay, so all in favor of the motion to waive refund, thank you, refund the 190. All in favor? All opposed? And abstentions? Did you vote, Sue?
We did.
Okay. And I didn't count.
3-4.
Which
so,
way?
Against.
Okay, let's move on to
It's opposed.
opposed, right? Okay, let's move on to enforcement action number 1. Related to Ithaca Press. So a motion to approve is written. First from Sue, the second from Ed. Anything for Adriel that you want to add to the record that isn't already here, that the board should understand? Any discussion on this one? Okay, all in favor is written. I think that's unanimous. All right, let's go to the next one, which is the Brew 22 Coffee and Espresso. Is there a motion to approve this written? First from Shauna. Second from Samara. Adriel, is there anything you want to add in terms of discussion for this to help with context?
I think the kids had provided in the highlights, some explanation, so additional explanation. So if you had a chance to read that, I don't know that I have anything to add to what's there in the highlights in this portion.
Okay. Discussion from board members on this one. Yes.
Can you explain how the fee was generated? I mean, obviously, they had some issues and they did some things they weren't supposed to, but I couldn't follow. Because we don't really see things like this very much. If there was a fee structure that led to that number.
There is an algorithm that was used to that. I used for that. It was, and I apologize, I don't know, I don't have the breakdown, but it is based on the current violations of these falsified reports, as well as missed reports from the recent past coming back to.
It include those other two.
Yeah.
So this is a question that I wanna, so I feel like I wanna understand more this fine. Because I agree with Sue, we have never seen a fine like this outside of the tobacco things that we've done. And so it's not clear how we got to 8,700. Although I understand that there's some significant violations here, including falsifying water sample reports, which we also, I don't believe, have seen before as a board, which is a little obviously serious. But I think we need to understand how we got to 8,700 before.
Yeah, I don't know that I can give.
Yeah.
Yeah, I don't know that I can give you detail of each component that led up to it, but they did use their finding a logarithm that they have and based it on there are multiple violations of the rule here. Because every time a falsified document was there, not only was it a falsified document, but the work that was required to be done, the sampling and testing wasn't completed. So that's a violation as well. And so I think that those, as you put all of those together, is what gets us to it. If you'd like us to bring it back to you next month when we can certainly do that. But I don't have anything.
Let me ask other board members, Sally, about that. So I see a yes, is that a yes? I would have to enable, I guess.
I'm also a little surprised that this sanitary code doesn't address falsification of laboratory records. That seems like a big old loophole.
That's New York State.
Yeah, New York State sanitary.
Yeah.
And it doesn't address it directly. There's
Right.
no brains of falsified reports in subpart 5 of the state sanitary code.
Okay, so can I table this for next time?
Yep.
And do I need to vote on that or I can just table, it, right? Okay. Okay, great. So then the last thing on here is the discussion of the encampment notice violations. And so is that you, Frank?
Yeah, I think
Okay.
Liz assigned that one to me, right?
Okay.
Yeah.
All right.
All right, great. We'll do it together. And it's really by way of update. Probably saw some of it in local media a bit too. We've been meeting with the city and the railroad. We mean environmental health to talk about the situations in the encampments. It resulted in the issuance of a notice of violation to each entity related to the encampment that is bordered by Tabor Street and the railroad as a starting place, because that was the most intense place, and it also has an impact on the waterway as well. So we've had really good communications with the city and the railroad. I think everyone is in agreement that we want to get the situation cleaned up and resolved. By way of the notice of violation, they were both given 30 days to submit a plan to environmental health on how they propose to do that. That 30 days isn't up yet, so there's still a bit of time. So once we get those plans, then we'll review them and talk through with the city and the railroads about what they're proposing to do. I will add a word of caution that there's factors that will likely play into the timeline around weather, of course, wetness of the ground. The waterway is DEC protected, and so there's likely to be permits that are necessary to be pulled to do anything in the waterway. So we're expecting some or all of that to be part of the plan that comes forward with a proposed timeline on how they will move forward. My understanding is the city has already posted signage out there for anyone that's in that area, letting them know that they shouldn't be there. So it's kind of all in the works. The city is also looking at their plan that they passed several months ago. I don't remember how long, but related to the red, yellow, and green zone idea that they were proposing. So I know they are considering that as part of, kind of the totality of how they're going to address this issue. I think it's been fairly positive to date. I think there's a lot of new folks at the city, and they have a new city manager, which has kind of changed the dynamic and who we communicate with. So that's been really positive. The railroads are certainly supportive, and they've actually been good about sharing some thoughts and ideas about what they've experienced in other places too, to try to help work through solutions for this. But I would say all in all, it's going as well as it could be to date. But we're still not at the heavy cleanup phase, which I think everyone is looking forward to. So hopefully once we get the plan back from the city and the railroads, we'll have a better idea of what we're proposing and what we can expect on that front.
Questions, discussion?
Who gets the DEC permit, Frank?
The landowner.
And the landowner, are there two landowners, or would it be just the railroad?
No, it's the city. Actually, I believe the city is the landowner that abuts the water, and the railroad is on the other side of the property. So I think in this instance, it would be the city.
Will there need to be special contractors brought in to deal with the hazardous materials, or will the city employees be responsible for that?
I don't know the answer to that question. Obviously, we'll be looking to see what the city's proposing to do. Anything that they propose to do, we would expect be done in a safe manner. So, I think all of that is still to be determined.
A little bit to add to that, the city has cleaned up an adjacent piece of property in the past, and they have a way to go about it and do it safely. So, but whether they will be doing it this time or not, I don't know.
Does the city have the authority and the power to clean up a site such as this on their own at any level of contamination that they deem actionable without us getting involved?
Well, probably if there was a concern that there was some type of hazardous waste on site, then they would need additional permits from the DEC to do that, but there's no indication that there is.
I'm sorry.
Well, my question just kind of gets to the tipping point, I suppose. So we got involved because we got some complaints, but at a lower level of contamination of waste of whatever nature, does the city have the prerogative to step in there at any point they choose?
The property owner, whoever they might be, always has the opportunity to do what they think is appropriate on their property whenever they think it's appropriate. So it's really up to the landowner to take care of things. And part of what we're expecting to see from a plan is sustainability. right? What we don't want is to have it cleaned up and then 6 months, a year, 2 years from now, see the exact same thing there again. So that's been part of the conversations we've had with them and what we're hopeful we'll see as part of their planning.
No, he just answered your question. I was just wondering if our authority went to just cleaning it up in this space and time, and then what happens in the future, but.
What happens with the people who are living there?
That's the $1 million question, I think, that we're trying to figure out as a community. We've been very clear throughout this process that this enforcement process is not about whether or not people should be allowed to live on the land. It's about the land needing to be kept in a sanitary manner. And that's really the approach that we've taken. I think there's a lot of conversation going on with the county and the city and community partners to try to address the homeless population and what we're going to do for them. So I don't think there's a direct answer to that, except for we're trying to be as, humane as possible through this process.
Frank, I'll turn it back over to you.
Okay, so in follow-up to our conversation at the last meeting, I wanted to share some information about what's been going on in the department related to opioids, just to kind of do some level setting, and then, the board, we'd love to hear your thoughts. Your thoughts on, what the path forward might look like beyond that. So you're gonna hopefully. Sorry. All right, so last time we had some conversation, there was a lot of question about what we're doing around communication, data, some of the program that we have going on. And also I wanted to share about some of the community planning and what's been included in our community planning for you all. So I'm gonna start with press releases because communication was a big part of the conversation. I went back about 2 years just to use a rough time frame. It's kind of where we moved completely out, where COVID wasn't a primary response activity anymore, and so it felt like a good place to start. And we've issued 7 press releases in that time of varying types. From talking generally about mental health and substance use disorder issues in our community to alerts around fentanyl being in the drug supply, to the data that we provide related to overdose deaths on a regular basis. So I will get this PowerPoint out to all of you post the meeting. All of those are links. So if you want to go check out, more specifically the language that was in those, you'll be able to do that. So on average, we're doing a press release every 3 months or so on opioids, and each of them maybe on a separate subject or a separate topic within the structure of that problem. But we're generally trying to be consistent with, giving people information about what's going on and avenues to seek support. There's at least one RFP in that list as well. So talking about additional resources and initiatives that we're putting forward in the community. I would say, I think with almost all of these, I did follow-up media, whether it be with WHCU on the radio, with our print and online partners, and even some television from the regional television stations. So we do try not to say no when we have a media request on anything that we're working on. So data. We have a good bit of data. If you haven't seen it, we have an opioids page on our website. And in that, we've been posting data regularly for quite some time of different types and have been continually trying to grow the data that's available out there right up to the data that we just recently put out at the beginning of the year around demographics for our fatal overdoses in the community. I did want to just kind of show you what's out there if you haven't seen it. So when you go to our substance use page, you will see a data section. Is that?
You got used to
Oh,
share
excuse me,
yes.
yes. Hold on a second. I thought I was being fancy and knew what I was doing, sorry. Let's see. There we go, good. You'll have to remind me to go back to the slideshow when I'm done with this. So, so on this webpage, actually at the beginning, the links that are up there is to the data. And then we also have opioid resources out there about fentanyl, xylazine, testing for those, naloxone and availability and such. I'm not going to go into that today, but just know that those are out there. But from a data perspective, we've been partnering with our Department of Emergency Response to be able to provide the 911 calls for overdose / poisoning. I can talk a little bit about scrolling. Overdose / poisoning. So one thing to know about the 911 center, people call 911 and they don't know the technical terms or they don't know the way we want it described, so it fits right into our data. And so there's a bit of parsing of the data that has to occur. And this is one of those areas. And so the 911 center has been really good about providing us that information. We've been able to post that monthly. I apologize. It's screw it up if I do that. So there you can see there's data from the 911 center. There's actually multiple tabs associated with that data, so you can look at it in different ways. I would also share that the Community Justice Center, who's involved with the public safety reform, has recently put out a data page as well, which has even more information about the 911 call center. So if you have interest in things even beyond overdoses and opioids, there's a lot of information out there, as our DA, our sheriff, and IPD. So there's a lot of information out there about emergency response right now, if folks are interested. So that's the 911 call center. Then we have been putting out drug-related death data. The first thing that we come across here is our unintentional overdose deaths demographic data. So this is the most recent data chart that we put out. And there's a lot of information here over the last 5 years. So we did an aggregate of 5 years of data to de-identify, because while our numbers of fatal overdoses are higher than we would want them to be, they are still small enough that even on an annual basis could be identifiable. So this is an aggregation of it. And so you can see by year, you can get information by how many we've had per month. We have the age ranges. I apologize, I can't do both and have it be on the screen. Yeah, sorry. But age, rate, ethnicity, education, location, where in the county, the occupation, marital status, and veteran status, as well as whether they were hospitalized in the previous 2 months. In looking at this data, 2 things kind of jumped out at us. One of the big one was that in the occupation category, you'll note here that the highest category is food service, right? So an intersection with what we do from an environmental health perspective. And it's a place where we're going to do some investigation on, is there a way for us to try to address that differently, right? If we have folks that are working in that industry that are being disproportionately affected by this, we want to have some intervention there. So, so that was the demographic information. We've been providing the actual drug-related deaths every 6 months, going back to 2019. So this data is out there. usually around the end of July or August, we have all of the information on the fatal overdoses. There's drug toxicology that has to be completed on them. So oftentimes it takes a little bit, particularly for those that may have occurred in June, for us to get all the information for the medical examiner to make a declaration of cause of death. So usually around August and usually around February, we're able to put out the previous 6 months. So you can see we're on a trend here of, I didn't need to do that. There we go. Let me scroll. But what we can say is we're certainly been trending up, right? 22 and 23 were equal, but higher than we want them to be. And there's, an obvious issue that we overdoses are a problem in our community. I think one of the project that we're working on now by way of new data is trying to look at non-fatal overdoses. So we've been talking with our partners at the hospital and Cuyahoga Health Partners to try to get some data from them about folks that are entering the emergency room. So getting more data, demographic data about those folks, because quite honestly, those numbers are big enough that we will likely be able to make some actual correlation, if not causation, that we would be able to act on. These numbers are still relatively small in the fatal overdoses that it's hard to draw significant conclusions from, but it definitely tells part of the picture.
I have a question.
Sure.
Are you also working with REACH? Because I think many people that are overdosing are not going to the hospital. In fact, probably the majority of them are not making their way there.
Yeah, we've had some initial conversations with them, but their data ends up being more anecdotal. And we're not able to pull it in a way that is easy to tell. But yes, we certainly want to get to our partners. Our thinking around it was the numbers going to the emergency department were large enough that we would be able to draw some conclusions from, and then look at the other community partners that might also have information about it to help bolster that once it's done. We're still in the early phases of it. Sharing data is challenging, and I think we've made some inroads, and I'm hopeful that we'll be making some progress on that front. But yeah, REACH, STAT is another partner that interacts. We had an overdose in front of the mental health building a few weeks ago, and it was traumatic for me being one of the folks that showed up after the first staff were there, and the person declined going to the hospital, even though having been not breathing for close to 30 seconds while we were out there. It was a tough thing to see. And we EMS had to leave once care was refused. They left and had to go to another call. We sat with the person until a family member came and got them. Had it happened someplace else, they might have just sat there by themselves, right? And who knows, what could have happened. So it is definitely an issue that we need to be looking into and trying to figure out. And, anecdotally, what we're hearing from EMS is it's happening more and more. And Narcan is a miracle drug. Having seen it firsthand, it is a miracle drug. But it also creates these scenarios where we can reverse the overdose and the individual impacted isn't incapacitated to be able to say, I don't want care. Right. So yeah, good question. Also on this page is the New York State opioid quarterly report. So New York State sends this information to us, and then Ted pulls out the Tompkins County data. And so there is some information about naloxone rates, ED visits, synthetic, and they look at death rates as well. They're a little behind timeline wise, which is what we're trying to get ahead of. This isn't too bad. This data is actually coming out quicker than most other data. And so what we're really trying to get to is as close to real time as possible, so that way we can have real time interventions. But this data certainly is informative and gives us kind of a place to begin and start talking about where we can target our resources.
And Frank, you said this is Tompkins County data,
It's
but
not
coming from the state.
It's coming from the state, but this is Tompkins County. We also have links here to the state. So this is, it's a summary of our data from the state's data. So that you can go and search by county, which is right down here, which is the next item. So the full reports, you can get links to, and then there's additional data on the state website that's available on their dashboard. And we have directions here. You can go there, click on our county, and then you can see the different types of data.
So is Cuga Health feeding the state of the state? Is that where it's coming from?
Yeah, some of it is from there. I'd say most of it is from there. It's coming from the healthcare systems that are required to report certain things to the state. Some of it's coming through claims, Medicaid claims and other ways, the one nut that we have yet to be able to crack, the public health system, is the insurance and Medicaid information. They know what's going on. Our insurance companies know more about us than you probably would like them to know, because they have access to all of that information, but it's proprietary, right? And so we don't have open access to it. The state is working to try to make the Medicare information more readily available, but that's also slower.
It seems like a natural nexus between that and public health, and they can hold on to the data as quote proprietary for us killing people in the process. So, and I think that we should think about that perhaps as a society. So.
A lot of that hinges too on how specific the ICD-9 coding is to be able to get to what you're looking for. And sometimes that's a limiting factor that you don't have the code to be able to apply to the situation that would allow you to retrieve it. So I'm not sure how operative that is in this particular segment of the arena.
I guess I think it's 2024, and it's incredible to me that we can't figure out how to easily provide data, because it's so ubiquitous and accessible in so many other ways. So it's all literally going into an electronic system as it is.
Yeah. And when we're talking about the healthcare system too, we don't treat substance use disorders the same way we do or the flu, right? It's a whole separate system. It's not always paid for by insurance. It's not looked at as the same way, and the stigma is still there. We don't, you would never question a cancer patient or blame the cancer patient for their situation, but it still regularly happens to people that are suffering from substance use disorder when there's a blame component of it. So yeah, I would agree. There's a lot of room for improvement in our healthcare system. So moving on off of data, community planning, I wanted to point out our community health improvement plan, and there's a link to it there on the slide. We chose promoting well-being and preventing substance use disorders as one of the areas we focused on. Underneath that, 2 focus areas: promoting well-being, strengthening opportunities to build well-being and resilience across the lifespan, facilitating supportive environments for all ages. And then focus area 2 is mental and substance use disorder prevention. And so I wanted to point out that this is a community plan, and it's designed to be a roadmap on how our community can try to address these things, not necessarily that the department needs to be doing all of them. So I feel like there's a chip in the local services plan that I'll show you in a minute. We are trying to provide to our community a roadmap on some of the ways that we might be able to help improve this. There's obviously more detail under each of those in the plan, but I wanted to, just give you a flavor of what's there. The local services plan, these are the 7 goals that were identified in them. Workforce and housing being number 1 and 2. One of the biggest challenges facing our system right now is the inavailability of enough people to do the work that needs to be done. Social workers, psychiatrists, peers, across the board. It is a huge problem, both for OASIS, substance use, mental health, and developmental disabilities. And of course, housing, I think we've all come to recognize housing is a primary problem. If we can't figure that out and get people stabilized with supportive services, that it's very difficult to try to address the other issues. Below that, crisis services, cross-system services, non-clinical supports, adverse childhood experiences, and transition age services. So for those kids that get to 18 years of age, unfortunately, in a lot of our systems, the services available become much more scarce once somebody turns 18. So just something, these are the things that have been identified in the local services plan on the, the mental health side of the house and the community service support side of the house, I should say. So again, a path forward potentially for our community. And then lastly, I just wanted to talk about some of the new initiatives that come out. We've expanded our opioid overdose prevention program. It was just confined to Green Street. It is now covering both buildings, so we're able to more readily get Narcan available to the people that we interact with. So that was a big improvement, particularly for this building. We launched the care teams. We have an active care team with the Sheriff's Department that's been working since the late summer. And we are now active with IPD as well. So we have a social worker that we've assigned to IPD and is supporting their work. And the new chief there is extremely supportive of that work and is going to be looking to see how we can perhaps expand that relationship into the future and future budgets. Through Harmony's work, we received pilot funds from OMH to expand the outreach worker program. So you may have been familiar with the longstanding outreach worker program on the commons that got expanded a little bit beyond the commons, that the city, Downtown Ithaca Alliance, and the county supported 2 positions for. We received funding to add 2 positions that were covering the rest of the county. That was a one-time pilot, but thankfully the legislature provided funding to continue that. So we have actually now brought both of those together, the downtown and the rural, into one program, and we're in the middle of an RFP to try to find a vendor to administer that program. We facilitated the county's opioid settlement fund task force, which distributed $725,000 to different community organizations. And if you don't remember or weren't aware, the link is there to the press release that the county put out that lists all the organizations and how much they received and what they received it for. So that's a good place to get that information. And then lastly on here, we've led the Community Services Board to create a rapid housing and crisis services program using opioid settlement funds. So the county got opioid settlement funds and the Community Services Board got opioid settlement funds. And with those funds, Harmony, with the help of community partners, developed a program for rapid housing for individuals that are interacting with the crisis system, whether it be law enforcement, care teams, the hospital, or others. To get them into rapid housing and put support services around them quickly. So that process is actually an RFP as well. We have selected Catholic Charities of Tompkins and Tioga County, and we're in the process of getting a contract in place so they can start administering that program. So that's just kind of a quick rundown of the communication we've done, the data that's out there, the planning that we've done with the community, and some of the new initiatives that we've launched. Not included here is all of the continued work that the department as a whole has been doing around mental health and substance use for some time. So with that, I will stop, and I'm happy to answer any questions.
Just curious, would the care team would have been perhaps helpful in the situation of someone not going to the hospital and being on the street there like that? And
it's a good question. Having been there, I don't know. I will hand it to the IPD officers that responded as well as the ambulance folks. They were doing everything possible to try to help the person make the decision to go. And I don't know that, Harmony and I were there. We had 3 nurses there and a social worker. In that
What do you
case,
need?
yeah, in that case, there was, I don't know that you could have, it wasn't about the service or who was there. It was it is where we are and trying to figure out beyond that. I would imagine there are many, many situations where that level of people is not there. And perhaps, the care teams will help, in the future. And we're certainly, looking forward to that being a reality.
What was the reaction from the substance use subcommittee, when you gave the presentation?
This president?
Yeah.
You guys are the first one.
Oh, wait,
getting
I thought
it.
this was the one you gave to them. Okay.
No, no, substance use subcommittee. No, I don't know. That's a good point, though. I probably should.
Just because they're a little closer to it, so it would be interesting to hear.
And I think
They-
they know most of this, right?
Okay.
Because they're involved in
Yeah.
some of the decision making around what we do and don't do. So this was more because this group felt a little bit disconnected
We
from
did,
some
yes,
of that.
that's
Yeah.
right, okay.
I thought I read in your report that, people were working on getting groups in the Department of Health, Department of Mental Health, sort of more working together.
Yes.
Are there any areas that you see here where there's room for that?
That's a good question. I mean, I think some of that's happening organically. I know Sam's team has been working with the clinic and been a big part of the opioid overdose prevention program coming to this building. We are, of course, close to getting licensing for the space over here to provide mental health services. Those cross-functional teams that we're talking about are more, they're generally more structural for the department and how we're coming together. But one of them is going to be looking at, one of the ones we're about to launch that we prioritized, will be looking at the client experience and where are the gaps, what might we be missing, those types of things. So to date, all of them have been very internally focused, but this next round will start to look to the outside of it.
I appreciate your comment that, we have one organization that looks at a lot of food service, and then another one that's realizing that that might be a source of some of the.
Yeah. It was eye-opening. I never would have imagined. And when Frankie was presenting the data to us, it was like, really? And but it makes sense, right? When you think about, the environment and the wages and, some of the things connected to that. So there's definitely, that's why we look at data, right? Is to try to find those places where we might be able to do something different.
I mean, you haven't,
Well, food service and construction is the top two. Both of those are places of work that when you talk to the owners of them, they say people drift in and drift out all the time. Always a job available.
but I mean, the other thing is food service, environmental health has lots of connections with food service workers. So it doesn't always have to be Sam, like it feels like there's other
Yep.
intersections within the health department that might make sense to look at.
Yeah, we're in those spaces,
Yeah.
right? I mean, that was the thing, is it jumped out. It's like, wow, that number is so big. And, oh, hey, we have people that go to those facilities once a year or more often, where there might be a place for us to have an intersection of providing information to the owners, to the workers, and, trying to figure out how we can support those things. Narcan. And Narcan, yes.
Right, everybody, I think we've covered our agenda items, so I'm gonna go ahead and close our meeting out. Have a good month of April, early May, and we'll see you in May for our next board meeting. Thank you.
Yeah, thank you.
Yeah.
Appreciate it.